Good morning, everybody. This is Dr. Alok Sharma here. I'd like to welcome you all to this webinar, um, which has been specially put together for people from the United Kingdoms, Ireland, and some countries in Europe. So, the topic of my talk is recent advances in the treatment of autism, cerebral palsy, and various other neurological disorders. I am a neurosurgeon and director of the Neurogenic Brain and Spine Institute, where all the work is done. I'm also professor and head of department at the Medical College in Mumbai. I wish to, at the beginning, state that this presentation is for information purposes only. It is not a substitute for a medical consultation, for which you should obviously see your local doctor. And we gratefully acknowledge the parents and caretakers from the United Kingdom who have invited us to make this presentation. So, why are we all here? We are here because we all have special needs children or people in our families who have a neurological disorder. I understand most of you are parents of children with autism or cerebral palsy, and you have gone from pillar to post and you've been told that nothing can be done for your child. And there can be nothing more frustrating than have a child suffer from a neurological disorder or any medical disorder and be told that nothing can be done about it. You have been told the only solution is rehabilitation, so I'm sure all of you have given your best rehabilitation to your children. And then, of course, you pray. You pray for a day when your child will become okay. And I'm here to tell you that finally your prayers have been answered. And medical science, technology, and research has come up with solutions that can actually help our children with autism and cerebral palsy and reverse, yes, reverse autism, which was something which earlier we never even thought was possible. So, the combination of treatments we use is three. We use a combination of cell therapy using what is called stem cells, we use rehabilitation, and we use integrative therapies. So we are using a combination of three treatments. So we are going to make our children okay with a combination of three treatments: cell therapy using stem cells, rehabilitation in a more aggressive and comprehensive fashion, and integrative therapies using various forms of oxygen and other vitamins and medications that can actually help in recovery of the brain. So in today's talk, I'm going to talk about all three of these different aspects of treatments, and it is the combination that works. All right, so I showed this picture slide to make a point. Now, on the left hand side, you see an x-ray of the leg where the bone is broken. You can see this bone is broken. Yeah. Now, I ask you, if we or anybody we know has a fracture of the leg, will we take rehabilitation and physiotherapy on a broken bone? Will we ever? No, we will not. We will go to an orthopedic doctor, he will put plates and screws, fix the bone, and then we will take rehabilitation on a repaired bone. Isn't that correct? But for a children with a brain problem, we do exactly the opposite. So here is a scan of a child with autism. The blue area is the area that's not functioning properly. You can see this damaged area. And we are giving rehabilitation on damaged brain. Now, what if we could repair the brain? This is the same scan. You can see the brain. There is green over here. Green is functioning brain. Blue is damaged brain. You can see the brain has started functioning. What if we gave rehabilitation on repaired brain? Won't our results be much better? And I'm here to tell you that this is possible. We can repair the brain damage. And once we repair the brain damage, the same rehabilitation with which we were struggling and getting limited improvements, we will now get more and better improvements. So the old thinking was that the central nervous system is incapable of regeneration. For 150 years, the medical profession has believed that once the brain is damaged, nothing can be done. But the new thinking, and that's what I want to introduce you to, that some regeneration is possible using cellular replacement and repair. So it is possible. This is the new thinking. We can repair, we can fix brain damage. So the first thing we will look at is stem cell therapy. Now, cell therapy is something which shifts us from a state of hopelessness to one of hope. What exactly are stem cells? The word stem comes from the stem of a tree. And just like the stem of a tree gives rise to branches, leaves, fruits, etc., there are some cells which can give rise to any cell of the body, whether it's a brain, a muscle, or a heart, or a blood. And the cell which can become any part of the body, that cell is called a stem cell. So stem cells we can derive from two sources. We can either get it autologous, that is from our body itself, or we can get it from somebody else, from a donor, when it is called allogenic. So there are two broad kinds of cells, autologous and allogenic. How do stem cells work? So the first ability of stem cells is that they multiply. If I have a single stem cell, I can make it into thousands or millions of stem cells. Two, they convert into other cell types. So if I have a single stem cell, I can make it into a brain cell, or into a heart cell, or into a blood cell, or a muscle cell. The same cell can become any tissue of the body. Thirdly, and this is just to show you from our research, this is not a picture from Google. This is what a stem cell looks like. And before we started treating patients, we grew stem cells experimentally. And we showed that a stem cell can become into a brain cell like this. This is a brain cell and it's communicating, and we can actually convert stem cells into brain cells. So this is part of our original research. Stem cells also release certain positive chemicals, and these positive chemicals help in healing the damaged brain. These chemicals are called growth factors, and these growth factors, when they increase, they actually help in the whole repair process. They also improve the blood supply to the damaged area, and when blood supply improves, more nutrients, more oxygen comes. So this combination of being able to multiply, of being able to become any cell type, of releasing positive chemicals, and improving the blood supply together repairs the damage. So there are different types of stem cells. You can get stem cells from the embryo. This is from the unborn mother, from aborted tissue or spare test tube babies. We all started life when our mother's egg and father's sperm came together, and that one cell became two, two became four, and on our fifth day of life, we were a bundle of stem cells. So all of us on our fourth or fifth day of life, in our mother's womb, we were a small bundle of stem cells from which the whole body was formed. Right. Now these stem cells are called embryonic stem cells. There are places where it is used, but we do not use this because there are ethical issues about its use, and also there are certain medical dangers. So I wish to repeat, we do not use embryonic stem cells. You can also get stem cells from the umbilical cord. The umbilical cord is the cord that connects the mother and baby at birth. And so if you have preserved the umbilical cord of your child, that could be used, but we are not using this either. We are using adult stem cells. What are adult stem cells? Adult stem cells are cells which are found in our body. They are found in children also. Inside our bone, there is a liquid called bone marrow, which has got millions of stem cells. What are these stem cells doing there? They're all going to become blood. So if we put a needle into any bone and take out the liquid inside the bone called bone marrow, we can extract the stem cells from it. So we use this because it is very simple and safe to use. And the last type is induced pluripotent stem cells. These are in research stage only. Here the outside is adult and the inside is embryonic, but these are not being used in patients so far. So we work with adult stem cells because first, like I said, they're totally safe. They don't form tumors. They don't get rejected. You can easily get them from a single needle, and there are no ethical issues about its use. How do you inject the stem cells? There are different ways. So you could inject them with a very thin needle into the lower back, into the fluid of the spinal cord and brain called cerebrospinal fluid. This is called intrathecal injection. This is what we use. We prefer this because the stem cells from here go directly to the brain. All right. You can also inject it intravenously, intramuscular. You can give it through the nose, through the arteries, directly into the brain, etc. But we prefer the intrathecal. So, what exactly is stem cell therapy? Basically, stem cell therapy is the use of healthy cells to replace damaged cells. So, if this is a scan of a child with autism, the blue is the damaged part. If you put the stem cells, the damage goes away. What is the scientific base for stem cell therapy? You're all aware that the most prestigious award given in medicine is the Nobel Prize. It is given for the highest level of science that has impacted humanity. And in 1990, Dr. E. Thomas, in 2007, Dr. Martin Evans, and in 2012, Dr. Gordon and Dr. Yamanaka, they won the Nobel Prize for stem cell research. So, the most prestigious prize in a 15-year period has been given three times to stem cells. There is no other field of medicine that has got the stem cell, that has got the Nobel Prize so often. But stem cell therapy has. And what's the scientific base of the work we do? So we have over 100 publications, 101 to be exact. What is the relevance of publications? See, when we publish a scientific paper, it is called peer reviewed. Peer means somebody outside of me has reviewed the data, analyzed the results, and found it to be useful and scientific and ethical. So it's basically our work is validated by an outside party. All our statistics, our figures have been validated by somebody outside. So we don't have one or two. We have over 100 and we have over 100 papers. 16 of which are in autism, 15 in cerebral palsy, 18 in muscular dystrophy. And now medical textbooks. So this is a medical textbook by the SMG group. The name of the book is Recent Advances in Autism. And they have introduced a chapter on stem cell therapy. And when they were looking for who should write the chapter, they approached us and we wrote the chapter. Then there is a book on cerebral palsy. This is a European book published by Intech, and they also introduced a chapter on stem cell therapy for cerebral palsy, and they asked us to write the chapter. Then physical disabilities. This is another book, therapeutic implications. They have a chapter, stem cell therapy in pediatric neurological disabilities, again written by me. Here's a book on muscular dystrophy. Which has got a chapter, stem cell therapy in muscular dystrophy. Again, they asked us to write this chapter. So the point I'm making is we have 101 scientific papers and modern medical textbooks on specific subjects like autism, CP, muscular dystrophy have not only started introducing chapters on stem cell therapy, but whenever they, because they have to decide who should write it, they approach us to write the chapter. Now, the government of India at the highest levels is very supportive of stem cells. Our Prime Minister, Honorable Shri Narendra Modi, when he visited Japan, he actually visited the Stem Cell Therapy Institute of Professor Yamanaka, who won the Nobel Prize. It's not often that Prime Ministers visit hospitals and stem cell and research facilities, but he did that. In India too, whenever he gets a chance, he visits stem cell therapy facilities. I'm very fortunate that in one of the books that I have written, Honorable Prime Minister Sri Narendra Modi has written an introduction. Again, it's not often that somebody at his level will write an introduction for a medical book. But I'm very honored that he did. And this is me, I'm presenting that book to him. And this is the chapter, this is the introduction. You can see it's in the regional language. That's my name and that's his signature. So he wrote this chapter for a book of mine. And here you can see him speaking in Parliament very passionately about stem cell therapy.
मैं जापान में तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा मैं वहाँ एक नोबेल लॉरिएट साइंटिस्ट का वहां को मिलने गया, मैं इसलिए किया गया तो उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी खोज हमारे काम आ सकती है। हम गए तो वहां गए, उनसे चर्चा की और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज इस दिशा में हमारा काम हो रहा है कि स्टेम सेल के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें।
So, again, this is the Indian Parliament, and you can see the Prime Minister very passionately talking about stem cells. So now let's look and see how this treatment is done. So that's the beauty of this treatment. It is not any surgery. There is no cutting, there is no stitching, there is no operation. The whole procedure happens with just 2 needle pricks. So what we do is we take a needle and we put it. This is a diagrammatic picture. We put the needle into the pelvic bone, which is above. This is the hip bone. Above is the pelvic bone. This is a real life picture, and this is a diagram. And we do this. The child is given sedation, anesthesia, so the child is sleeping. We give local anesthetic, so there is no pain. And in about 15 minutes, we aspirate and withdraw the bone marrow. What we have taken out, we take it to our laboratory. We send the child back to the room, to the parents. We take it to our laboratory where we filter it and separate the stem cells out. And then once we have taken the stem cells out with a very thin needle, we inject it into the lower spinal fluid, and from the lower spinal fluid, it goes up. So the whole process has only 2 injections. With one, we are withdrawing. What we withdraw, we take to our laboratory and filter it, and with one, we inject it into the lower spine. So let's see a video of how this is done. That's the bone marrow aspiration coming out. That is us separating the stem cells in the lab. And that is us injecting the stem cells. So you can see it's a very, very thin needle, and we inject it into the lower fluid. So let me just watch this again. That's the bone marrow aspiration. You can see the bone marrow coming out, child is sleeping. And there again, you can see with a very thin needle, these are the stem cells we are injecting into the lower fluid. So 2 15-minute procedures, both involving needles only. There is no cut, no stitch, no going into the ICU, nothing like that, nothing severe or dangerous. So that again, just to show the bone marrow aspiration, the cell separation, and that's the injection. So now that we have looked at stem cells, let us look at some of the diseases. Let's look at autism. So autism, which is a neurodevelopmental disorder, was first described only in 1943. Is diagnosed in the first 3 years of life. We now refer to it as a spectrum disorder. And the boys have it 4 times more than girls, and it could be mild, moderate, or severe. There's been a dramatic and significant increase in the incidence of autism over the last 20 years or so. In 2004, 1 in 166 children had autism. In 2018, it is 1 in 59. And now it's even reduced to almost 1 in 40. So there is something wrong. There is a massive epidemic of autism across the world. And it doesn't have the attention of governments and societies and of people. Why is it that autism is increasing so much? I mean, that is something we need to look at. So by this data, it means 70 million people on the spectrum have autism. That is 1% of the world's population. I repeat that. 1% of the world's population is on the spectrum, which is a very large number. So the problems in autism are basically poor communication, poor social interaction, and repetitive behavior. That's the combination of 3 things: speech, communication, repetitive behavior. What is new is our understanding of autism, and what is new is the fact that we have a treatment available now which can actually fix the problem. So this is our original research, and this is a side view of the brain. You're seeing a scan of the brain from the side. Whatever is blue is damaged area. So we've done this in some normal children where the PET was being done for other reasons, and not a single normal child had this blue. Whereas every single autism child, more than 3,000, have had exactly more or less similar blue scan pictures. So our research, which is by the way published now in a prestigious journal, World Journal of Nuclear Medicine, shows very clearly that there are definite parts of the brain which are damaged in autism and which are the cause of all the symptoms. So this is, like I said, the paper which was published in World Journal of Nuclear Medicine as to what are the changes in the brains of kids with autism. Now here's something interesting. We found that normal children, their brain functioning keeps improving over the years from 5 to 15. But children with autism, it kept on decreasing over the years. So you can see. Now, why is this important? It's important because what do we want in our children? We want their brains to grow normally like this, right? But this is how their brains are going. So if we treat here, we have to bridge only this gap. If we treat here, we have to bridge this gap. So the earlier we treat, the better it is. So the management of autism has now become multidisciplinary, and there are multiple aspects of rehab, other treatments, and stem cell therapy is one part of it. I wish to repeat, stem cell therapy by itself cannot cure autism or reverse autism. It has to be combined with all these rehabilitation therapies and all the other therapies that are listed here. So now we looked at stem cells. Now quickly let's look at neuro rehabilitation. So there are different types of, since all of you are familiar with this, I will run through this fast. There is something called applied behavioral analysis, which works on changing behavior. There is occupational therapy, which has got several subcomponents, which includes vocational, recreational, school-based training, play therapy, activities of daily living, etc. There is sensory integration therapy, which is a field all by itself, which is also very useful for kids having sensory issues. This is what a sensory integration loop looks like. Then there's speech therapy. Now, earlier the focus was on physical speech, but now speech therapists are changing and saying the focus should be on communication, whichever way they can communicate. Now, earlier it was believed that physiotherapy has no role to play in autism, but we have learned that these kids have motor issues like motor coordination, clumsiness in limb movements, tone abnormalities, gait, postural stability, etc. So it is important that a good physiotherapist evaluate and treat this as well. When rehab is going on, they may need physiotherapy apart from occupational therapy. And aquatic therapy is available. It's a newer form of rehab. Aquatic therapy is not swimming. It is rehab in water. It is exercise in water. And we have found does a lot of benefits. It improves the cognitive function, the attention, concentration. But most importantly, it improves the sleep patterns and it reduces the hyperactivity. So, so these are the different. There's art therapy, there's music therapy, drama therapy, and then there is removal of heavy metals, so chelation and DRS detox. There are various supplements which I'm sure you're all giving, like B6, vitamin C, omega 3, DMG, inulin, etc. So there are various supplements, but these have to be very selectively and judiciously used. You don't just give the child a cocktail. You have to understand what exactly he needs. Diet has an important role to play in autism, and there are foods to eat and there are foods not to eat. So all the pre and probiotics, ketogenic diet, gluten, casein free, these are all foods that we should. Camel milk is supposed to be very useful. Curcumin is useful. The foods to be avoided are anything with sugar, additives, pesticides, inorganic processed food, etc. And there's something called ketogenic diet, which is high in fat, adequate protein, and low carbohydrates. But the question is, I ask you, are we doing enough? Can the rehabilitation by itself fix the brain problem? And the answer is no. So these are our results of stem cell therapy in autism. We have now treated more than 3,000 patients, but this is data from 700. And our analysis shows that 90% of the kids, almost 89.2%, have improved, 10% don't improve. Now, 33% of our kids had a significant improvement. That means they have reversed their autism totally. They've lost the diagnosis and label of autism. When they go and get analyzed by anybody, they don't have autism. That's 33% of our patients. 29% have a moderate improvement, which is a good improvement, but the diagnosis of autism remains. They still have certain issues. 25% had a mild and 11% did not improve. So these are our overall results with autism. Now, on what basis can we make a claim that stem cell therapy works in autism? See, I'm a responsible doctor. I cannot just come and say, oh, this works, that works. To be able to say that, I need to have statistical significance of our results, and I need to show you objective proof. Here, look, this is what is happening. The brain is improving. So let me show you some of that. So this is like data. We take the mean score before stem cell, and we take the CGI score, and it was 4.5. And then we take the mean score after SCT, and then you can see it is 3. Now, by a mathematical calculation, we've tried to figure out whether it is significant or not. So these are the two scales, CGI and ISA. It's an autism scale Indian scale for autism. So we showed that there was a statistical significance, so we can make the claim. And here again, this is broken down into symptoms, social relationship, emotional responsiveness, behavior, sensory. And we take the average of all the patients before and after, and we showed that all cases it was statistically significant. Now here, this is the most important slide of my talk. I'm showing you 2 or 3, but actually I have over 3,000. Yes, I have over 3,000 such pictures before and after, showing that the brain damage that causes autism can be reversed. So let's look at this picture. These are all the same patient, same picture in different angles. So the center is the blue area is the damage. Here also is the damage. And here also is the damage. You can see this is before stem cells. Now the same patient 6 months after stem cells, and you can see this entire blue has gone. You can see this entire blue has gone. You can see the entire blue has gone. This, my dear friends, is objective proof that the brain damage that causes the symptoms of autism in your child can be reversed. And there is absolutely no reason when cells from the child's own body can repair the damage in the brain, we should not use it. And I don't have 1 or 2, I've got 3,000 such patients, 3,000 such scans. Here again, just to show you the damage before, you can see, and you can see after the stem cell, there is no damage. Here again, you can see before the stem cells, huge damage. After the stem cells, no damage. So these are all objective proof that stem cells are working in autism. Now, some people asked us, but how do you know the improvement remains over years? So in a few patients, we did it year after year. This 2012, you can see the damage. In 2013, after the first stem cell, you can see it's much reduced. In 2014, it is still reduced further. So whatever improvement you see is sustained and progressive. It continues. It's not a one-time thing. Now, our work is published in one of the world's most prestigious journals, Stem Cell International, and the world's first international paper on stem cell therapy in autism came from our country, and we wrote it. The second paper came from China, the third paper came from Italy, the fourth and fifth paper have come from America. So as you can see, Europe and America are behind this. India and China are ahead of them. And we have 16 other scientific papers as well in autism. Now, I've got a couple of videos. I've got 5 videos, one from each continent, North America, Europe, Africa, Asia, and Australia. But for want of time, we will just see 2 or 3 of them. And these are videos of actual patients who have taken stem cell therapy, and you can see for yourself what improvements they had. The first video is this child from America. His father was a cardiologist, doctor, mother's a nurse. They came to us. The child couldn't speak at all before. He had a lot of behavioral issues. And now let us see the effect of stem cell therapy on this child.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backward.
He would flap like that. He would walk on his tiptoes, look at the wall, and be talking to the wall. If he had problems with eye contact, he'd never look you straight in the eye. He had problems with his speech. Some research and found out about NeuroGen. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer. And I said, we have to do it.
Started seeing better eye contact, definitely different than his engagement with us, with his siblings, his mood. He's so much calmer now. He's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. It's all the PET scan images. I can't tell you the word, we were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh has gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months.
So there you saw a child with no speech behavioral issues, how from a special school to normal school. This is in America, and he is now actually, getting A+ grades. He's topping his class. So this is the magic of stem cells. Now, I know all of you as parents, you believe there can be nothing more difficult than managing your child with autism. I want to show you a movie of a mother who had triplets. All 3 of them have autism. Can you imagine having 3 kids with autism to manage? So let us see her story. She's from Nairobi, Kenya, and what her experience with stem cells was.
I remember one time coming home and the nanny telling me that she has been told that my sons should not go out. People, parents, please lock your doors. Those who don't want my sons to get into their houses, please always keep your door locked, because there is no way I'm going to close my children in the house. Only thing is the cancer in my house, and I have 3 cancers in my house. Mothers are saying, you're so strong. How do you do it? 3 kids, we are collapsing with 1. How do you do it? We have targeted everything, our time, our resources, our energies towards eliminating this monster.
The boys were born in 2011 in California, US. They were prematurely born.
1 year when their milestones were okay.
Each boy was moving separately, not getting together, and you could see that the attention was span or the attention was very limited.
But as they grew up with life, these boys are just so active. By then I would have expected when I call Eric, Lenny or Rick, he would be able to respond. So I got it because the three of them, no one knows their names. The boys also didn't seem like they were recognizing their mother.
We expected them to have developed speech by 3 years, but they did not.
We went to different doctors, we went to different hospitals, and when I brought it up, they were like, oh, no, don't worry, it's because they are boys, they're triplets, they were premature. I would be walking out and I'm like, bye. No child is crying, no child is waving back bye. And by then, for sure, I knew that they should be doing that.
The first time I saw them in the classroom, they were all over the place. You would see Lenny climbing up the windows, Eric somewhere under the table. Ricky was a bit mild, but he still had his own challenging behaviors.
The whole semester, the booklet came and it was just written still learning.
They were picking anything on the ground, any food and putting it in their mouth and that again, and it was really advantageous.
If you come to my house, you'll find that the TV is actually, we put lots of drills on it because several times they have dropped it down. We have put lashes on every door inside and outside because these kids can rush into the kitchen and get into an accident. The seats are all broken because of jumping up and down, tearing them, eating them. The children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night.
You'd hear that Lenny has crushed someone, Lenny has killed someone, Lenny is spitting on other kids.
The biting, the spitting, the scratching. How are we going to stop this behavior? Neurologist, and in 5 minutes, he said, his children are autistic. It was like being told your children are dead. From that moment on, I remember thinking each day, each week, each month. I remember thinking, what will happen to my sons when they grow up? I remember thinking of all those people we see in the streets and we call them mad.
As parents, it was very traumatizing. First of all, we didn't understand what autistic means.
So I decided to really get to read a lot about autism.
We came to understand what it requires. A lot of occupational therapy, physiotherapy.
I tried diets, GFC, casein-free, gluten-free.
I kept on seeing the neurosurgeon. What he was prescribing was only medication to keep the boys happy. And it wasn't helping them.
I remember the first time I read about stem cell. I was like, wow, this is really good. The mechanism, the treatment was scientifically sound. I read about NeuroGen because there was a flyer. Me at home. And then someone is coming here to talk to us about it.
Last year, we had lecture come Nairobi and give a lecture.
There are 70 million autistic kids in this world. There was no treatment for them. But today with stem cell therapy, we at NeuroGen have been able to treat over 1,000 children, and many of them have gone back to a normal life, to a normal school.
Before when we left the meeting, my husband was like, let's go next week. Our journey to NeuroGen was very smooth and very pleasant. We were received at the airport. The infrastructure that we have, that already gives you a good sense of safety and honestly, if I had money, I would stay here for 4 months.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma. We got a lot of clarity, and we became very confident with it.
You really get to have your child assessed by all these different people who are all looking at different aspects. I had never gone through such a kind of an assessment. The day of the stem cell itself came. Actually, I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension, anxiety, of course, I knew, but I knew the What I like most about NeuroGen is it's a hospital and a research institute at the same time. It's in line with the global trends. They are really on top of the cutting edge. After stem cells, we went now for our usual therapy. I like the fact that they're using a multidisciplinary approach. They have all these departments: special education, ABA, occupation department, psychology, nutrition, physiotherapy, speech therapy, all these things under one roof. The children now are able to get much more and make more faster progress. Stem cells has really unclipped our wings. It's like now there's freedom to fly. Stem cell has really given my sons a new lease of life. At the day of the stem cell, we are seated there, Eric trying to sneak out of the door, and Rick is on the other corner and he goes like, Eric, come back! Eric, where are you going? Come back! And we all froze. We are like, did you guys hear that, or is it just my imagination? Ricky, who had one word and occasionally 2 words, he did a 5-word sentence and all very well placed.
The boys are calmed down, have increased their attention span.
Standing number 7. Where is it? 7. Awesome. 8.
Lenny wanted to keep hugging you, to keep holding you, touching your face. His fingers suddenly could be able to coordinate. His mood swing really changed. Eric now is able to stay outside of the house unaccompanied.
The children didn't know when a car is coming, it's supposed to move away. They used to move towards. Right now, they are moving away like, whoa, this is dangerous.
Their social interaction has really grown. Occasionally, I see the boys now tickling each other. It's like suddenly we are realizing, oh, we are here together. They will even hold hands and do their favorite. Form of a ring of roses. It's like magic. Miracle was happening because when they came back, there was a big difference in boys, and it was they able to express themselves as much as they wanted.
Yeah. Mama.
Ricky was just like, okay, it can hang on my cheek, and I'm like, all right, this is Ricky.
I was so shocked I screamed because I knew very well this boy couldn't talk. Stem cell works, but I didn't know it was really going to work this fast.
The things that would have taken probably years to be accomplished in my son, in like 8 months' time, we've really been able to come very far.
They used to defecate on their clothes, but now they can use the toilets. We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment, he's taken to his bed, takes a few minutes, and he's asleep.
The boy's behavior has really improved such that our travel to Neurogenic Mumbai, this time it was really very, very pleasant. One of my dreams has been to see my son's face. We try to make them understand what it is to have the ending. But after stem cell, when we arrived in Kenya the following day in the evening, and this makes this cycle. The school, I remember after 2 weeks, the teacher calling me and saying, Mercy, really stem cell is working.
Stem cell therapy has come with a lot of blessings. There are things we used to struggle with as teachers that started falling in place. Okay, I want you to show me some body parts. Show me your eyes. Yeah, that's correct. Eyes.
Eric?
Think it is.
Good.
Okay, and put you the same. And the last one is this one. Very good.
Ricky is doing just so awesome. He is growing in all areas, academic, socialization.
Rick, nice to meet you, Shadow.
Hey, come here. Down. Good job. Down. Wow. Well done. Ricky. We can even walk in the streets of Nairobi. He can actually go to the shop and pay and get back the cake and come and I'm going to send it to buy tomato paste. Okay? I'm going to send it to buy what? In the shop. Where is the shop?
Yeah.
Okay. So I'm going to give you
Mine.
for what?
Mine. Money.
we are able to go to the children to the supermarket, to the public gathering, to the church, and they are not as disturbing as they used to disturb before the stem cell therapy.
The boys are actually going to Sunday school, humming some songs and trying to repeat the actions. It's nice to see all these things unfold right in front of your eyes when you really didn't expect that to happen. The other thing that we do as a family yearly is to take the boys to the national park. So you can imagine this time when we went there and the boys were just awesome. Just the other day, we actually went out to a nice Chinese restaurant, and the boys behaved so well. I couldn't just believe it. They ate their meals, they wore their napkins, they enjoyed the meal. If you just pass by, you wouldn't know that my sons are autistic. So this is really something I have longed for a very long time. It's something I've prayed for, and the fact that we can be able to do this, it just delights my heart.
The major achievement was getting Rick from a special needs school to a regular or normal school.
What is the name of your school?
Just morning junior school.
Doing so well without even shadow teacher, and he's even doing academics, which I had not dreamed for my sons doing academics.
I'm very happy because when he went to the regular school, he coped very, very well. And the teachers there are able to work with him.
Just seeing the pets can resort, seeing all that blue coming down, you are told that Eric has had 60% improvement, Lenny 40% improvement, and Ricky was told just a few more points and he'll just get off the spectrum completely.
This means our children in future are getting to be self-reliant, and this is very encouraging.
I'm very, very grateful to the NeuroGen team. Henry and I no longer walk the autism journey alone. That aftercare, they are so many miles far away and they are calling you, they want to find out how are the children doing. Dr. Sharma looked at my sons and he was like, oh my God, it's a lot of work for you. But what I can assure you is that these are my sons now and they're gonna get better. You have no clue, what this meant to me as a mother. It is so relieving. I can look forward to for tomorrow because I know tomorrow definitely is better.
For parents who have children in similar conditions, I would encourage them not to lose hope, but to seek stem cell therapy.
We've seen tremendous changes as professionals working with children with autism after they've gone for stem cell therapy. And I'd really encourage parents to have confidence in this intervention. I strongly believe that it can push our children to the next level in their lives.
After I die, I want my 3 sons to be independent and lead a better life than myself. Rick, Eric, Lenny, I love you.
They say that autistic children have no emotions. But for me, with my son, this is a big mistake. I'm seeing my sons expressing the emotions. Ricky is actually telling me he loves me, and I find myself crying. You know, just tears of joy, tears of disbelief. It's something that only a mother can understand. It tells me that autism can be reversed. Parents ask me, so do you really think stem cell works? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell works. I'll do it until my children get well.
All right, that was slightly long, but that was meant to show you the story, the journey of a family with 3 children, how difficult and challenging it is to bring up 3 autistic triplets, and the amazing improvements after stem cell therapy. So I'll just finish the rest of my talk very briefly. We'll talk of a couple of other conditions. Okay, yeah, sure. Hmm? So we've looked at autism. Now we'll very quickly look at cerebral palsy. In cerebral palsy, there is damage to the brain, but you see the effects more in the body rather than in the mind. There are different types of cerebral palsy. It could affect just one side of the body. It could then it's called hemiplegic, or conversely, it can affect the lower limbs, all the limbs, and there are different types depending on the type of damage. And here is a scan that shows you that you can see the blue. It's black. It's much bigger. So the brain damage in cerebral palsy is much more than that in autism. There are certain medical drugs that you can take for convulsions, spasticity, etc. There are certain surgical procedures, neurosurgical and orthopedics, that we can use to correct the deformities, but it doesn't make the problem go away. So stem cell therapy, on the other hand, has amazing results. We have treated more than 2,500 patients. This is our data from 600 patients, of which 20% had a significant improvement, 41% had a moderate improvement, 30% mild, and 10% did not improve. So again, roughly a 90% success rate, but in autism, if you remember, 33% had a significant improvement, whereas in cerebral palsy, it is 20%. And these are the symptoms that improve: their oromotor drooling, their balance, trunk, lower limb, upper limb, tone in the muscle, ambulation, etc. And here's a scan that shows you can see above is the damage, all the blue areas, the damage you can see before, and you can see after the stem cell, the blue is significantly reduced. Here again, on the left-hand side, you can see the damage, and on the right-hand side, you can see the blue is significantly reduced. This work is published again in Stem Cell International, and this is our paper. It was not the world's first paper, but it was amongst the world's first few papers. And we have several other papers as well on role of stem cell in cerebral palsy. And now let's look at a video of a child from Kenya who was totally wheelchair bound, could not stand, could not obviously walk, could not use his hands, and from a totally wheelchair bound state. What improvements he had? Let us look at that. He could not sit or stand or walk independently. You can see afterwards, you can see now he's able to use his hands. He can wear and remove a t-shirt. He can put things in a bag. See, he's able to, earlier he couldn't even stand. Now, not only is he standing, he could remove a bottle from the fridge and he could drink it, open it and drink it himself. So there you can see him before, totally wheelchair bound, and now you can see he is walking independently. So this is the miracle of stem cells. A totally wheelchair bound child is able to now walk independently by himself. So just as it works in autism very well, stem cells works with cerebral palsy as well. There's another disease, muscular dystrophy, in which the muscles become gradually weaker. You can see at 5 years in a one type called Duchenne muscular dystrophy. All these children died by the time they're 25. That's because the muscle, you can see at 5 years, gray is normal. And if you see over the years, the gray is becoming less and it is becoming totally white. By 16, it's totally white. That means there is no muscle in the body. All the muscle is replaced by fat. So here you can see the difference at 5 years and 21 years. At 5 years, full of muscle. At 21 years, almost no muscle. And these are our results with over 1,500 patients. 85% improved, 4.5% had a significant improvement, 35 moderate, 20 mild, 15% remained stable. They didn't worsen, they remained stable. Now, what you have to remember is if we had not done stem cells, all of these would have deteriorated. They would have deteriorated. So stem cells helps to save lives. And this is a comparative study between treated and untreated patients. So when patients were treated with stem cells, the green graph shows how they stabilize. And those patients who did not take stem cells would deteriorate like this. So that is the difference between treated patients and untreated patients. And here it becomes a matter of life and death because these patients do not survive, whereas these patients survive. And here's objective proof. You can see there is white above, there's no black, no muscle, only fat. And post stem cell, you can see that muscle has come back. And pre-treatment, you can see a very weak EEG, and post-treatment, you can see the EEG is nice and strong. And we have published 18 scientific papers on the who had Duchenne muscular dystrophy. He could barely crawl when he came to us. He could not even sit properly, or even standing was not possible. He had not stood for 2 years before he came to us. And let us see his improvements. He's 8 years old, case of Duchenne muscular dystrophy. And you can see now, before you can see he's barely able to crawl. And after stem cells, he stood for the first time. He had never stood for 2 years before. And apart from standing, he started walking a little. You can see some movement in his legs. And they're small movements, but you have to remember that earlier he could not walk at all. Now he's just walking with a parallel bar. And now see, he's walking without any support indoors. And soon you'll see he'll be walking outside. He's walking outside without any support. He was invited to meet President Obama when he heard about his improvements after stem cell therapy. So there he is in the White House. Stem cell therapy also works for intellectual disability, and here the damage, as you can see, is a little less. It's more widespread than autism, but it is less than cerebral palsy. And these are our results. 84% of the patients improved, 20% significant improvement, 13% no improvement. And all these things improved. Their memory, problem solving, social inhibition, toilet training, all these things improved. And here you can see a scan before, you can see the damage, and you can see afterwards the damage is gone. You can see the amazing improvement where all the blue, this is before stem cells above, and below is below stem cells, and you can see the damage is gone. And again, we published the world's first scientific paper on the role of bone marrow cells in intellectual disability. This has been published by us in Stem Cell Research and Therapy. And we have 3 other scientific papers. Then there is spinal cord injury, which happens due to a fracture of the spine due to a road traffic accident or fall from a height. And this is our data from 1,000 patients. 24% had a significant improvement, 50%, 56% moderate, 15% mild, 3% did not improve. And these are the various symptoms that improved. This is a published paper on thoracic stem cells and thoracolumbar spine injury. And these are our different other papers. And here is a soldier from the Indian Army who was shot by terrorists. He was totally paraplegic when he came to us. That means he could not move his legs at all. He could barely sit. And after the treatment, you can see he's first sitting by himself. He's able to transfer. He can get off from the floor onto a wheelchair by himself. And he's able to get into a car. And now you can see he's able to walk independently. This is a little older video. Now he's actually able to walk without this. And he was awarded the highest, one of the highest bravery awards, Shaurya Chakra, by the President of India. He then went on to shooting and won the bronze medal in the National Shooting Championships. And he joined back active duty in the army. It is very, very rare for anybody with a spinal injury and paralysis to be taken back in the army. But he improved so much that the army took him back. Brain stroke. This occurs when there is one side brain damage which results in paralysis of the opposite side. This could be either because of a hemorrhage bleed or because of decreased blood supply. And this is our data. So you can see 51% of the patients have a significant improvement. Only 3% don't improve. So there's a 90% success rate. And here's a scan. You can see before, this is the brain damage, and afterwards, this brain damage is gone. Dramatic. You can see here. Above, this is the brain damage before stem cells, and after stem cells, the damage is gone. And we have 6 scientific papers on this. Then there is head injury, where again 29% of the patients have a significant improvement, 5% only don't improve. And here's the damage before, and you can see the damage afterwards. And you can see all the damages got cleared up. And here's a scientific paper published on stem cell therapy in traumatic brain injury. 2 other papers. Then motor neuron disease. This is the last topic, and this is a disease where 90% of the people die within 5 years. There is no treatment for it. There is a short death, and this is a comparative study we did: treated versus untreated patients. So treated patients stabilize like this. Untreated patients continue to deteriorate. So there is a significant difference between stem cell treated patients and patients who did not take stem cells in terms of their survival. And our work is this is what is called a control study, where you compare treated versus untreated patients. It's published in the American Journal of Stem Cells. And we have a whole lot of other papers on this as well. So a question which all of you must be asking is, how safe is this procedure? We've heard all good results, but is it safe? Is it risky? Are there any side effects and complications? So here's the good news. It's a very, very safe procedure. There are no major adverse events or complications. We've now treated a total of 10,000 patients, and there's not a single patient who's deteriorated, become worse because of the stem cells. So it's a very safe treatment. There are some minor adverse events. So those children who have epilepsy, there's a 3% possibility that the epilepsy can increase after the treatment. Then 10% of the patients have a spinal headache. Some patients have nausea, vomiting, local pain, etc. So these minor adverse events are transient. They are very short-lived, and they're totally reversible. So there is no major complications. Some minor side effects which last for a few days and they resolve all by themselves. So now we come to, that concludes the results of stem cell therapy, and now we come to integrative therapies. So what are integrative therapies here? There's a combination of integrative therapies are machines and equipment with which we try to improve the blood circulation and the oxygenation to the brain. That's the whole purpose of integrative therapies. So there is something called hyperbaric oxygen therapy, HBOT, of which many of you must have heard about HBOT. So basically what it does is it floods the oxygen with 100% blood and 100% oxygen. So there's a chamber. You go inside the chamber and you lie down. It's very relaxed, it's very comfortable. And oxygen is given under pressure, so it goes into all aspects of our, like the smallest corners of the body and the brain, the oxygen goes because it goes along with the liquid. So we have found that